A 25-year-old man has been charged with murder and the preparation of terrorist acts after a fatal stabbing of British MP Sir David Amis. Well, Ali Habi Ali was arrested following the attack at a constituency surgery, the town of Leon C, east of London. Sir David, a Conservative MP since 1983, suffered multiple stab wounds and died at the scene. Mr. Ali is a British man whose father is a former advisor to Somalia's Prime Minister.
The case that no other arrests have been made, and at this time we are not seeking anybody else in relation to this incident. There has been considerable speculation in the media about the background, history and motivation of the man now charged. I understand the interest in these questions, and of course they form part of our investigation. However, now charges have been brought, we will not be providing further information on any aspects of this case. We've been working closely with Parliament's own security team and with the Home Office to review existing arrangements for MP security, and that work will continue. Police forces across the country have been working with individual MPs to review their specific arrangements.
Now let's go back to our top story. And as India celebrates 1 billion COVID vaccination, the WHO has warned that the pandemic will go on a year longer than it needs to because of vaccine inequality. Well, for more on this, let's now cross live to London, where our ICE correspondent Lape Olarinoye actually joins me now. Let's have this conversation. Lape, we thought that by the end of this year, the pandemic will be over. But what are some of the factors really causing the virus to extend into next year?
Well, good evening to you, Amaka. Of course, like you said, we did think it was going to end, much sooner than we had expected. I mean, it started in 2020. We did assume, okay, it will go on throughout the period of 2021. But now it seems as though it's going to go into 2022. And mainly the factors contributing to this are because of the hoarding of vaccines that we saw when the vaccines first came out late last year. When we were given those vaccines, we were told that a lot of the richer countries were hoarding them, but we're seeing this trend continue. And let me just put this into perspective for you, Amaka. In Africa alone, only 2.5% of the continent has been vaccinated in comparison to the rest of the world, which is completely dire. And as you can imagine, people will travel, people will move about, and of course, will transmit and pass on the infection to other countries, which means that it is counterproductive if we simply don't share as much as we can.
Of course, speaking about sharing, the WHO, they have been, talking about sharing. Let's talk about the implication of this vaccine disparity, especially between the rich countries, which we're almost seeing 100%, or close to that vaccination rate, and poorer countries like here in Africa, like you have said, less than 3% vaccination rate.
Yeah, I mean, really and truly, the implication of that is going to last for longer than we had imagined. I think initially when the richer countries really wanted to make sure that their citizens were safe, that they were protected, and they were curbing the spread of the virus, a lot of us didn't think, in the long term, the impact that this will have on many people that don't live within these richer countries. And if we look at, Africa or India, for example, who, like India, have been, badly affected by the pandemic. If we look at countries like this, they have been clamoring, countries like India, South Africa have been clamoring for the patents to be released for them to manufacture their own vaccine so they're able to vaccinate their own citizens. This still hasn't been agreed to. We also know that Moderna were trying to encourage a manufacturing hub in parts of Africa to allow for this. But many of the African health officials don't know about this and are not aware of this. So it seems as though it's rhetoric and language games. And even worse, Amaka, when the richer countries, grabbed these vaccines and tried to hoard them at the beginning, we found out that yet again, they had bought too much and had to donate once again to these poorer countries. So it is really a question of how are we going to make sure that the right people get the right vaccines and so that the world as a whole can emerge back into what we deem as normality. It's not really going to happen if the most vulnerable people and the people that live in third world countries or people don't have access to the vaccine simply can't get the vaccine or can't get jabbed. And we continue to encourage travel, we continue to encourage trade, and of course, the betterment of the global economy. It won't work if we don't get everybody vaccinated.
The fact that you've talked about, the global economy, because we know it's been impacted heavily by the COVID-19 pandemic, but what impact will this have really on public health? In a minute, Lape.
Well, very quickly, Amaka, we know that now public health and the economy seems to be the tandem in which governments are trying to, prioritize which one's more important. But actually, in a very, very ironic way, we can now see that if you don't prioritize public health, your economy will essentially be affected in the long run. So, of course, if countries around the world aren't getting access to the vaccines, then unfortunately, many global economies may not be able to encourage trade, travel and tourism unless everyone is protected. It's as simple as that.
Of course, no one is safe until we're all safe and protected and, of course, vaccinated. Lape Olarinoye there in London. Thank you so much for joining me tonight.